and I will continue with the next part of the briefing, and I will brief you on a few things, and then there will be time for questions for me. So today, on climate, a new report by the World Meteorological Organization today said weather-related disasters have increased fivefold and caused 7 times more damage than in the 1970s. Over the past 50 years, weather-related disasters have killed 115 people every day and caused some $202 million in losses daily. However, improved early warnings and disaster management have meant that the number of deaths has decreased significantly from previous periods. Over the past 50 years, there were more than 11,000 reported disasters globally, with just over 2 million deaths and $3.64 trillion in losses. The report also says that more than 91% of deaths occurred in developing countries, and of the top 10 disasters, the hazards that led to the largest human losses during this period have been droughts, followed by storms, floods, and extreme temperatures. The full report is online. Moving to Ethiopia, our colleagues tell us that the humanitarian situation in Tigray is worsening, with stocks of relief aid, cash, and fuel running very low or depleted. Partners have run out of stocks for food distribution, with the exception of some areas where supplies had already been dispatched. According to our colleagues, the only access route to Tigray via Afar, using the Semera-Abala corridor, has been inaccessible since the 22nd of August due to insecurity and bureaucratic and logistical challenges. We estimate that 100 trucks of food, non-food items, and fuel need to enter Tigray every day to sustain an adequate response. Since the 12th of July to date, less than 10% of the required trucks have gone in. In addition, a minimum of 200,000 liters of fuel is required for the humanitarian response every week. But since the 12th of July, only 282,000 liters have reached Tigray, and none since the 16th of August. Our humanitarian colleagues also warned that the spillover of the conflict in Tigray into neighboring Afar and Amhara continues to affect civilians, resulting in food insecurity, displacement, and the disruption of livelihoods. Some 1.7 million people are estimated to be facing food insecurity in those areas. We stress that all parties to the conflict must allow and facilitate timely, unfettered, safe, and sustained access to all people impacted by the crisis. Turning to Myanmar, our team there remains concerned by the humanitarian impact of the ongoing armed conflict and insecurity across various parts of the country. Around 200,000 people have been displaced since February 1st. The situation has worsened with the impact of monsoon floods, which affected around 125,000 people since July, particularly in the southeast, eastern, and western parts of the country. Our team and our partners are making efforts to reach around 3 million people in need with critical assistance and protection services, including a pandemic response. For example, around 1.2 million people have received food and cash assistance since the beginning of the year, and assistance across other sectors also continues in other parts of the country. Our colleagues reiterate their earlier calls for everyone involved to facilitate safe and unimpeded access by humanitarian partners to scale up these efforts and reach everyone in need. We reaffirm our commitment to continue delivering humanitarian assistance, protection services, and COVID-19 related assistance in Myanmar, guided by the internationally recognized principles of humanity, neutrality, impartiality, and independence. And in the Central African Republic, the mission there has taken note of the final results of the residual legislative elections of July 25th, proclaimed by the Constitutional Court. This announcement marked the end of the 2020 to 2021 legislative elections in the country, with 140 candidates elected to parliament, including 18 women. The mission has provided support to this electoral process, including through security, in a context that, as you will recall, was marked by attacks in the capital, Bangui, and in the countryside. The mission there is currently working with the authorities to begin preparations for local elections, which will be the first ones organized since 1988. And our peacekeeping colleagues also responded to attacks by armed groups this week, particularly in the country's west and center. And the UN police units continue their day-to-day patrols in the capital's sensitive crossroads and elsewhere. The mission said today these patrols have contributed to a drop in crime in the capital as well as in the country's eastern region. And I just want to flag that in response to questions we have received, I can tell you that on the 19th of August, the state of Qatar signed an agreement to provide $40 million through the UN in support of poor and vulnerable families in the Gaza Strip. The allocated amount will be disbursed through a UN-implemented cash assistance program to some 100,000 families in Gaza as a one-time payment every month for a period of 4 months. As the program is about to be rolled out, the Secretary General wishes to extend his appreciation to the state of Qatar for its generous contribution, noting that this will help improve the dire socioeconomic and humanitarian situation in Gaza. The UN will continue to work closely with the Palestinian Authority and partners to support reconstruction efforts in this region. And I have a COVAX update for you. Pakistan has received over 18 million vaccine doses since May and has 6 more million doses expected to arrive in September. As of yesterday, more than 56 million doses have been administered. Our team there, led by resident coordinator Julian Arnaiz, is continuing its support to the national response. The World Health Organization established 3 vaccination centers in Islamabad and provided medical, laboratory, and protective equipment, including ambulances, 50 ventilators, 100 oxygen concentrators, 50 suction devices, 20 ECG machines, and 50 automated beds. For its part, the UN Children's Fund provided protective equipment to over 15,000 frontline workers, as well as over 3,000 oxygen concentrators and other equipment to the government. The UN Refugee Agency also donated 600,000 masks and ambulances, and the UN Office for Project Services is providing medical and laboratory equipment for hospitals in 3 districts. And you may have seen that earlier today, German Chancellor Angela Merkel and Dr. Tedros, the head of the World Health Organization, inaugurated a new WHO hub for pandemic and epidemic intelligence based in Berlin. The hub is part of the agency's Health Emergencies Program and will support the work of public health experts and policymakers in all countries. It will aim to provide them with the tools needed to forecast, detect, and assess epidemic and pandemic risks so they can take rapid decisions to prevent and respond to future public health emergencies. Dr. Tedros said the work of the new hub will focus on data linkage and analysis and on the ability to better detect and assess risks of disease events in the earliest stages before they amplify and cause death and societal disruption. The hub is receiving an initial investment of $100 million from Germany. And in a new report, the International Labour Organization says that despite the unprecedented worldwide expansion of social protection during the pandemic, more than 4 billion people around the world remain entirely unprotected. The World Social Protection Report finds that the pandemic response was uneven and insufficient, deepening the gap between countries with high and low income levels, and failing to provide the much-needed social protection that all human beings deserve. Social protection includes access to healthcare and income security, such as unemployment, sickness, or disability leave. The ILO is calling for more investments and international solidarity to build better social protection systems. And you can find the report online. And I want to flag that today at 2 p.m. right here, there will be a briefing by Ambassador Geraldine Byrne-Nason, the permanent representative of the Republic of Ireland and president of the Security Council for this month. And she will discuss the Council's program of work. And finally, we would like to thank our friends in Tanzania for their contribution to the regular budget. That brings us to 124 member states who have paid their contributions in full. And I think that's it from me. I will take your questions now. Any questions? Yes.
Thank you very much. And so, given the report about shaping the new government by Taliban, and so it's about there are no officials from previous government, and so what's about the question, the consideration of inclusive government, given the fact that UN, the other agencies and international community calls for inclusive government? Thank you.
I mean, is your question, I mean, I guess the Security Council made it very clear, and the Secretary General also made it very clear in his statement yesterday that what we are expecting is to see an inclusive government, and of course we're waiting to see what will happen as the government has not yet been formed, and although we know that that is to be announced imminently following. Any other questions? Did Ramiz answer all your questions? I'm very happy about that. Any questions on the screen? Okay, well, thank you so much, and Stefan, we'll see you tomorrow.